Acts of mass violence, which result in high numbers of people being killed or wounded, seem to be distressingly frequent in the United States, and they seem to be growing in severity. And this has arguably become a defining signature crime policy issue of contemporary times. Mass casualty incidents include a wide range of acts: family massacres, terrorist attacks, felony-related violence, hate-motivated violence, and other sorts of attacks that might be directed at coworkers, classmates, or just random strangers. And although these acts are rare in a statistical sense, they do produce a substantial toll. Thousands of people have been killed or injured in these acts in just the last few years. And I want to start this by saying at the outset that there are a number of complexities to studying mass violence, starting with the fact that there is no universally accepted definition of the term mass violence, nor is there any official, comprehensive national data source that can be used to track these incidents. When defining mass violence, one might define these incidents based on the number of people murdered, or one might define them based on the number of total casualties in the incident. Then after making that decision, one has to determine what will that threshold be. Will it be 3 victims? Will it be 4 victims? Will it be something higher? And it's important to keep in mind that different researchers and different data sources use different definitions. And so sometimes there can be variation out there in the field that you have to be aware of when you're looking across these sources. If we wish to look at incidents that produce mass casualties, there is, as of yet, no official national data source that you can go to. Now, there is the National Incident-Based Reporting System, or NIBRS, which is gradually being implemented across the country, and that is a new uniform crime reporting program that in which agencies provide a lot more supplemental data on each major crime that they investigate, and that data source can be used to track multiple casualty incidents, but it's not yet fully implemented throughout the country. I think somewhere between 30 and 40 states have currently implemented NIBRS. All of the states are supposed to be on board by 2021. Now, generally speaking, when people study mass murders, they often distinguish between 3 general types of events. One are familicides, or family-related mass murders, felony-related mass murders that might occur, let's say, in the context of a robbery, or they might be linked to drug or gang-related violence, and then other types of public mass shootings. Public mass shootings account for roughly 20 to 25% of all mass shootings, or all mass murders by firearms, I should say, but they are perhaps the ones that have the greatest impact on public perceptions and create the greatest fear. They are also the ones that tend to have the highest numbers of deaths and injuries per attack. So to give you some sense of the current magnitude of this problem, according to figures that were compiled by Grant Dewey, who is one of the nation's leading experts on tracking mass violence, over the years of 2014 to 2018, there were on average about 23 mass murders with firearms committed in the United States, resulting in an average of 138 victims killed per year and about 342 non-fatal wounded victims. Now keep in mind, this also includes the October 2017 incident in Las Vegas that resulted in 58 people killed and more than 400 injured. If we look specifically at public mass shootings, then on average we have about 6 of these a year, resulting in 60 deaths per year on average and 274 non-fatal shooting victims. One of the key issues that we wanted to address in the workshop is whether or not mass violence is increasing, whether or not it's becoming a growing problem. And one of the things that came out of the studies is that mass public shootings have been rising in recent years, and in particular, the victim counts in mass shootings have been rising. They are becoming more and more severe. So as an example, that is illustrated in this chart that was put together from Grant Dewey's article, in which he's looking at the victimization rate, the number of people shot and killed in these incidents per 100 million over the period of 1976 through 2016. Actually, I think he went through 2018. As you can see from this chart, there have been some ups and downs over time, But since about 2006, this shooting rate has been steadily rising. And over the last several years, we've had the highest levels that we've seen since at least the 1970s. This issue was also explored in another paper that was done by Adam Langford and James Silver, and they were specifically looking at the frequency of what they call high fatality public mass shootings. And they defined high fatality public mass shootings in a number of ways, as you can see in this chart. You can define them as incidents in which 8 or more people were killed, incidents in which 12 or more were killed, or incidents in which 16 or more people were killed. And they tracked all of these incidents going back to the 1960s, and here you see the numbers by decade. And what it shows is that these events have been occurring at an especially high rate during the last decade. So for example, if you look at incidents with 8 or more people killed, there were 34 of these events, and these are all public mass shootings, I should say. Going back to 1966, of those 34, 18, or 53% of them occurred just since 2010. And this pattern also holds if you restrict yourself to cases with 12 or more killed or 16 or more killed. A second general area of recommendation involved improving emergency responses to mass shootings to try to reduce fatalities. So in the wake of a lot of these incidents, there have been after-action reports that have highlighted lessons learned that are important for police and other first responders, emergency medical technicians, and for hospital staff and even other citizens. And if those guidelines are followed, they have the potential to reduce the number of people who die as a result of these incidents. A third area of recommendation had to do with formal tracking of mass violence. As I noted, there are various difficulties involved in measuring mass violence, and so we recommended that the federal government, either through an agency like the FBI or the Bureau of Justice Statistics, invest in more systematic, comprehensive data collection and tracking of mass violence incidents. The final area of policy recommendation that I want to elaborate on a little bit more has to do with improving our threat detection systems. And this means strengthening our capacity to detect and to respond to what people refer to as leakage. And broadly, leakage refers to different statements and behaviors by potential attackers that may signal their intentions and their dangerousness.
All right, thanks, Chris, for basically providing us some general understanding of mass violence in the United States, and also some general recommendations regarding what we can do. Okay, so as you may know, for the vast majority of mass violence in the United States, okay, so the offender will intentionally or unintentionally provide some leakage information. Okay, so based on our understanding, we think we need to take advantage of those leakage information, and that is critical for us to basically prevent such kind of incidents. Okay, so based on that, Chris and I proposed to do a study basically to take advantage of leakage information and basically to improve the threat assessment model in a more quantitative, structured way. So based on that, our overarching research goal here is basically try to build a structured, quantitative assessment tool for evaluating the risk of mass public violence and basically align the risk with the management strategies. Okay, so to our best knowledge so far, we do not yet have such a risk assessment tool for mass public violence. Okay, so a good analogous example here will be the risk assessment tool used in the correctional settings. Okay, so there are different generations of risk assessment. Okay, at the very beginning or in the first generation, it's basically we provide all those information to experts in the field. Okay, so they will do some professional judgment, and they will try to basically do their own subjective understanding or their expertise regarding the issue. Okay, and then they will provide some general suggestions regarding the level of risk. Okay, so that's the first generation, and then we have the second generation of risk assessment. Is basically we are gonna incorporate some personality or stable factors into the risk assessment model, and we're provided some structured instrument in order to assess the level of risk. Okay, and then during the third generation, people began to bring into the dynamic or situational factors into the risk assessment model. Okay, and eventually, ideally, during the fourth generation, what we want to do is we want to incorporate the management strategies into the threat assessment model. So basically, to summarize, what we want to do here is basically try to deliver 5 things to the DHS or to the law enforcement in general. Okay. So first of all is basically we want to deliver a refined threat assessment model. Okay, with additional investigative themes from a broader variety of dimensions. Okay, and as well as protective factors. Okay, and the second thing we want to accomplish here is basically we want to build a comprehensive database on completed as well as attempted mass public attacks in the United States. Okay, so this will be the first of its kind, and also it can be continuously maintained and updated. Okay, so we think this will be very important for the DHS and for other law enforcement agencies to identify and monitoring the trends of mass violence in the United States. Okay, and third is basically a data-driven typology of mass violence in the United States. Okay, so hopefully we think this kind of categorization will inform tailored prevention and recovery strategies. Okay, and probably most importantly, what we want to do is basically we want to have the so-called structured quantitative risk assessment tool for preventing future events and harm.